Thanks for tuning in to Community Connection. I'm Iowa City Mayor Bruce Teague. The purpose of this show is to help explain the complications of COVID-19 as we all work through this pandemic together. It's during these difficult times that our community partners step up to answer the challenge, and our hospitals are at the forefront of the fight. Margaret Reese is president of the Mercy Hospital Foundation and director of communications for Mercy Iowa City. Thanks for joining me, Margaret.
Thank you for having me here, Mr. Mayor. I appreciate that.
Yes, well, I've known you for a while and happy to know that Mercy Hospital is in the game and doing what they can during COVID-19 to keep people in our community safe and treated if they should have symptoms. And so want to dive right in there as to what Mercy is doing. I know that you have a lot of staff that are providing the care, but will you tell me a little bit about what it looks like if someone is coming in for a testing? Are you seeing them inside your building or outside your building?
Well, I'll say that Mercy is very much in the game. We were the first hospital in the state of Iowa to receive patients, and so we scaled up very quickly, literally overnight, much sooner than anybody else did, sometimes weeks ahead, certainly days ahead of other hospitals in the state. And we immediately, that first evening in the emergency care unit, realized that those individuals had symptoms of COVID-19, and they were masked and they were separated from the rest of the population. They were put into a negative airflow room so that they were protected and everybody else was protected. PPE was put on the colleagues who were caring for them. And so that was our first step. And after that, we immediately figured out ways to be able to separate individuals with respiratory symptoms from individuals without respiratory symptoms, and to keep our colleagues and, of course, patients safe. So one of the first things we did was to build a structure right outside of our emergency room to optimize the flow of patients coming in. So if anyone has respiratory symptoms, ideally they call us first. We have signage outside the door now, two great big signs that say, if you have respiratory symptoms, go back to your car and call this phone number, which they do. And then people are screened. And then, if appropriate, we swab them in their vehicles outside the emergency room, or we have them come into this tent-like structure that we have outside, and they are seen by staff. We have also recently added 6 more negative airflow rooms to our emergency care unit so that we have more than enough space to separate patients who may be positive for COVID-19 from the rest of our population. Also, we wanted to make sure that in all of our primary and specialty clinic locations, we were taking all the proper precautions. We have 25 of those locations spread across 5 counties. And we set up a drive-up testing area and also an acute respiratory clinic, which is in a tent or trailer outdoors where our Coralville Family Medicine location is. And so, again, if patients contact their provider's office, indicate they have any kinds of respiratory symptoms, then they are scheduled to go to either the drive-up testing or to the ARC, the acute respiratory clinic, to be seen and to be swabbed and so forth. So these were really, really important measures to keep them safe, to keep our employees safe, to keep any other patient safe, et cetera. And initially in this, the first month or so, because we are on day 59 now of our response, we were testing people for flu, and more people had flu than tested positive for COVID-19. And the flu is now pretty much gone, and the patients who are receiving positive test results are receiving positive results for COVID-19. But we did many, many things. We also restricted visitors immediately. We canceled a volunteer program, all the students who were rounding here for a variety of reasons, the practicum classes that we have here, all of those types of things. So we just did many, many things. And so it's been a remarkably safe environment. And I really consider this to be one of the safest places you could possibly be anywhere because of the precautions that we have taken.
I appreciate you going into detail about from the beginning of COVID-19, how your response kicked right into action. I imagine that that's something that you all have been preparing for emergencies such as this, didn't know it would be to this extreme. But when someone does come, what is your criteria for getting the test? Because we get that question as elected officials, and I know
Yes.
people in our community want to know what would you approve if they came in to get a test? What symptoms do they have to show?
Well, they need to call ahead, so they should call their provider. If they don't have a provider, they can call our Mercy on Call line, and we'll get them set up with a provider, or even do some basic screening over the phone. And then they will be told to go either to the drive-up testing, come to the emergency room to be seen outside, or whatever is appropriate for them. And we follow the CDC guidelines. And the interesting thing about this to me is that they change, and they change often, and they change regularly. So we have updated our screening whenever these are changed. And actually, the last time we updated them was April 29th. So it was just last week, at the end of last week, that we updated them again. So we will ask people if they have a fever, chills, body aches, headaches, a change in taste or smell, any respiratory symptoms such as a cough, shortness of breath, difficulty breathing, or sore throat. If they have any of those, then there'll be more questions. And if they are somewhere, they'll be masked, and then the exam will continue. We also ask if they have had any contact with someone who has had COVID-19, or who've been tested for it, has symptoms of it, or has been diagnosed with it within the last 14 days. And if no, that's good. But if they have, then they'll go deeper, and they'll ask very specific questions, such as, have they been within 6 feet of that person, or within the room or care area for that person, or been with that person for any prolonged period of time, or even deeper, have they had close contact with that person? They're caring for them, they're living with them, they're visiting with them, they've shared a healthcare waiting area with them. And then the most specific, the deepest really, is, have they had direct contact with infectious secretions? So somebody has coughed on them, for example, someone who they know is positive for COVID-19. So those are the types of questions that we ask as part of the screening. Initially, the screening was much less in depth than it is now, but this disease is much more prevalent than it was, and we know a great deal more about it than we did 2 months ago. And so the questions are more detailed, and again, we're following what the CDC recommends, but we're staying on top of it, and we change and update our screening checklist the day that the CDC makes any adaptations, and then we get that out there to everybody.
No, I hear you. The changes that is happening with COVID-19 and the recommendations as to who's eligible for the test is always changing. It has become more available for people, with some of the things that the governor's doing. But now the governor is opening up lightening up on the restrictions in 77 counties. And we'll learn more about how Johnson County restrictions will be around May 15th. With that being said, what are your thoughts on, you just talked about interactions. That's what you're assessing. What interactions have you had with people to kind of determine the risk factor of if someone is exposed to COVID-19 and the likelihood of them becoming a positive individual? So with the prospect of us opening up, what are some of the concerns that you all have, and how are you preparing for that, even with the elective surgery that is now allowed in Iowa?
Well, we know what we know. For example, we know how many people have been tested. We know how many have tested positive. We know how many have been hospitalized. We know how many have died, and so forth. But there is a lot that we don't know. We don't know how many people have been exposed and aren't aware of it. And what I learned from the state just this morning, actually, is that they are seeing, and this is pretty much what they have seen nationally, is that 20% of people who test positive are asymptomatic. So either they never show any symptoms, or it's still early. You can be infected for a couple of days, several days, and show no symptoms at all, but you're out there potentially exposing other people to it. So we don't know how many people have been exposed, and we don't know how many people will be exposed for that reason. So we don't know how many cases we're going to have. We don't know when this might end. We don't know if it will improve as the seasons change. We don't know what we don't know either. So are we concerned? Yes. We hope that people will continue to follow precautions because it's not going away anytime soon. We're predicting that this disease will be with us until we come up with a vaccine. And following precautions is absolutely critical. So that's really the only thing that we can recommend right now.
Well, I think preparing for the unknown is what you all are probably doing. And so it is concerning when we're thinking about the unknown and how people will interact and if they'll actually know what it means to take special measures to keep themselves safe. I have questions about your PPE. How
Sure.
is Mercy doing? And do you need anything from those in our community?
We never stop talking about PPE. Our
Yes.
incident command team has met daily for 59 days now. And we talk about PPE every single day, and subgroups talk about it even more during every day. So yes, we appreciate donations. They have been extraordinarily helpful to us, especially those cloth masks, because now we are giving them to patients when they come to the emergency room or they go to a clinic. We're asking people if they have a mask, please wear it when you come to the hospital or go to your appointment at the clinic. But if you don't, we'd like to give you one because we want to protect everyone. And if it's cloth, it can be washed and it can be reused, whereas a paper mask will be thrown away and then it's gone. There have been some very slight improvements to the supply chain in just the last couple of weeks, which means that we are receiving a bit more regularly the things that we order. We may not be receiving everything that we order, but there are some improvements. Although we're not jumping with joy at this point, but some improvements. So we're feeling more confident, and we're actually starting to change the course of our conversation, not only for having appropriate PPE today for safety and protection, but also as we start with surgeries again, which we did on Monday of this week on May 4th, that we have adequate supply for that, and looking ahead to the fall when flu season will come back. We don't doubt that flu season will be back and we'll need the PPE, and COVID-19. If there is that second surge or maybe it's an unending surge, we just don't know. We want to be prepared for that as well. So we are now looking forward to making sure we are adequately prepared no matter what comes our way.
Well, I'll tell you, one thing that I hear is that you all are definitely trying to figure it out. Now, I have questions about when we're thinking about the possibility of some treatment, and people are excited about the plasma transfusion that might be happening. What is Mercy? Are you doing anything with that? Are you partaking?
We are.
All right.
This is very exciting. This seems to hold great promise for people who are critically ill, and this is new treatment, obviously, because we haven't had the disease with us for very long. So people have to have had a positive test that is confirmed by their physician, and then they need to be at this time 28 days out from their last symptoms of the disease, and then they may be eligible to donate plasma. So there aren't really all that many people yet, but it's something that individuals are enthusiastic about because it's something that they could really do. 1 unit of plasma has the potential to possibly save lives, maybe up to 3 individuals, to have those treatments donated. So we are involved with that. We have actually successfully administered plasma to 3 patients so far in about the last 10 days. And that's based on the supply that we're able to receive, because again, there isn't a huge supply yet because people haven't been infected, sick, recovered for almost a month, and then had the opportunity to donate yet. But we are encouraging people, and we are starting to get the word out to those, to our providers, to the public, to the individuals that we have tested or have cared for to let them know that they may be eligible. And our blood and plasma supply comes from the Mississippi Valley Regional Blood Center, which services hospitals throughout the eastern part of the state and into Missouri. And they are very anxious to help with this, and they're all over it. And so we strongly encourage people to consider it, and they can go to Mississippi Valley's website or the Mercy Iowa City website and get information and even self-register or ask their providers to register. They still will need their providers involved because the provider has to certify that they had a confirmed test or confirmed test result. But we hope that they will do that, and we are actively encouraging them to do that because we have patients every day who would benefit from a plasma donation. And as I said, we've done 3 in the last 10 days, so we're very, very excited about that.
Well, that's very exciting. When do you anticipate the results or an update on how effective it is?
I don't know the answer to that. We see improvement within 24 hours of a patient who receives it, but what are the long-term results? Nobody knows that at this time. Okay. This is all just so recent. It was December, just a few months ago when the first cases were starting to be, the information came out of China about this disease that they had there and so forth. So there's just a lot that we still don't know. Remdesivir is another medication that is showing some promise to potentially shorten the duration, which of course would be a good thing because if you give it early enough, then maybe a patient doesn't get to the point where the illness becomes really severe and life-threatening. And that drug has been used only in clinical trials with research institutions so far. But we have applied now to be able to receive that, and we're going through the process, and we hope that we will be approved because that would be something else that we would be able to do. But finding a rock solid treatment and knowing what long-term effects are or what the long-term effects are of a patient after they've been critically ill with this disease or after they've been in the hospital for a month and been intubated and all that, we just don't know. But for right now, for Mercy Iowa City, we are taking exceptional care of our patients and doing everything we can and getting the testing done as we are approved to do so with the rules and regulations around it that exist, and just doing, I think, an amazing job with a terrific team here.
Would there being more at high-risk type individuals within our community, elderly people with underlying conditions,
yes,
such as diabetes? It's great to know that there is an option locally for someone to go and see if they would be a candidate to receive the transfusion. And it's nice to also know that if you are COVID-19 positive and free from 28 days, they can inquire of their ability to donate.
Yes,
which will
absolutely
also help along. So I am so happy to hear that there are things on the horizon that we're very excited about. This is very new it's novel for Mercy Hospital, for the city of Iowa City, and all of our residents, and honestly, the globe. It's a novel disease, and we're navigating it together, and I'm happy to know that you all were one of the first. Well, you were the first.
We were the first in the state. Yes. We're honored to care for the patients. We have an amazing team, providers and caregivers, and they have really stepped up and are working extraordinarily hard and doing a wonderful job. And this week, as I said, we've gone back to elective procedures as a slow ramp up for that, but adding more every day. And we are honored to be able to take care of people who have not been able to reach out for a long time, for a couple of months, to get things taken care of, that they may have pain or they may be uncomfortable, they may have symptoms. It's something that can be postponed without probably causing them any great harm. But that doesn't mean that you want to postpone these
Sure.
things. So we're really, really glad to be able to get back to taking care of people who need it.
Well, thanks for all that you all are doing. I want to give a special shout out to all of the staff at Mercy Hospital. You are all frontline workers, and we appreciate all that you're doing to keep us safe in our community. Want to shout out to you as well because I've known you forever. And so you being the spokesperson right now for Mercy on various fronts right now, it has been really great to see you out there and helping to get the information out there to people, because I think that's the most important thing. Lack of information, people can do things unintentional, and I think that that's something that Mercy is doing. So thanks to you. Is there anything you would like to say as we end our time here today?
Yes, there is something. I always have something else to say, and that is, there are two things. One, it is safe to access care. If you need care, call your doctor, call Mercy on Call, call the hospital, call whoever you go to, and tell them that you need care. It is safe to do so. We have every possible precaution in place. If you have a mask and you're going to the doctor or coming to the hospital, please wear your mask. Mm-hmm. And if you don't, we will try to get you one. And then please follow the precautions. This is the only way that we are going to prevent people from getting sick. Wear your mask, wash your hands, sanitize those frequently used surfaces. The steering wheel, the gear shift, the turn signal in the car, the phone, counters, faucets, computer, keyboards, tablets, your mouse, all these things, sanitize them regularly. Keep that distance when you are somewhere. Stay 6 feet away. If you're in the grocery store and you're following the arrows in the aisles, still stay 6 feet away from people and wear your mask when you go to the store. These are the ways that we are going to keep people from getting sick. And that's what we really, really want to do, have as few become ill with this as possible. It's a nasty disease for some people. For most people, it's a mild respiratory illness, and they may not have symptoms at all. But for some people, this is a life and death situation. And we just don't want to make it any worse than it has to be. So please follow precautions.
I am so happy that you closed with that, because as our state do open up, I think businesses returning are going to have to say those same things to their staff, and even create a curriculum such as those that we do for any other type training of how to navigate in this office with COVID-19 and be at your best success, taking less risks as possible. So thank you for ending with that, and I appreciate you and all that you and Mercy Iowa City Hospital does. Yeah, well, we worked you and I worked at Iowa City Hospice, so
it was
bound to come up.
Another great organization.
Absolutely.
Thank you so much. I appreciate the opportunity.
Yes, thanks. You can find additional resources for medical experts by visiting our website at icgov.org/coronavirus. There you will also find the latest city news and closures. We'll be back again next week with another episode of Community Connection. Until then, stay in place, maintain your space, and cover your face. We're all in this together, Iowa City.